Hi, it's Mike Kuhn again. Today I'm here to talk about Isomeric's allergy testing kit and how it compares to some of the competition out there, namely being Allervision, Greer, and some of the in-house services that come and do the allergy testing themselves. First, I'd like to reiterate Isomeric's allergy testing value equation, that being it's non-invasive, so there's no risk to the doctor. It's fast and efficient. You get the results in just 15 minutes, and it's highly reimbursable, which obviously benefits the office, especially in the times we are with healthcare. Um, First, looking at Allervision, right off the bat, it's a $100 flat fee per patient. When looking at Isomeric's 60 patient kit, it's only $83 per patient, so it's $17 cheaper. Over the life of the kit, that's $1,000 more you will earn using Isomeric's testing. You do a couple kits, and the revenue is significant. Although Allervision tests for 72 allergens, just like Isomeric, only 64 of them are environmental. The other 8 are food allergies, which Isomeric doesn't do because of the risk. When it comes to food allergies, there's risk of anaphylactic shock or other different difficulties that may occur, and puts a lot of liability on the doctor. Isomeric eliminates that liability. We just stick to the environmental allergies. If you want to just do the 64 allergens with Allervision, you're basically paying $100 for the 64 tests. So less tests, more expensive, not good for business. Looking at the sublingual immunotherapy drops, when it comes to Isomerics, they're custom. You could buy them as you go. We suggest a minimum of 4 months, but with Allervision you have to buy them in bulk, 4 months. The labeling is a little difficult to interpret. Isomerics are simpler, more customized, and ultimately just more user-friendly. But looking at the overall competition in terms of Allervision, Isomeric is cheaper, and there's less liability for the doctor because we don't do food testing. Looking at Greer, Greer is actually testing designed more for allergists and allergy practitioners who are frequently testing and frequently interpreting test results. It's a very intense kit with a lot of moving parts. You actually have to mix the allergen extract yourself before you apply them to the wells and then ultimately onto the patient. The testing itself is single testing, so while Isomeric does 72 tests within the 2 minutes, Greer you have to test all individually. This can take a lot of time. Also, with the scratch test, the scratch test itself, each prick requires a lot of training and practice. This ultimately leads to a lot more time and a lot more technique involved, so you kind of need to have a specialty person in your office to do that. With Isomeric, anyone can come and apply the test. It's simple. I have even been able to do it myself. It takes about a minute to learn. It's very easy. With Greer, you can buy it in bulk. It's not necessarily designed for smaller offices, general practitioners. It's designed for allergists that are seeing a lot of patients. They typically have a 2,000 to 4,000 patient kit. While this makes the tests themselves cheaper per patient, you do have to commit upfront the 2,000 or 4,000 patients. That can be a significant chunk of money upfront when you may not be using all of those tests. At Isomeric, we encourage most of the time our initial investment to be in the 20 patient kit. That way we can build trust, teach everyone how to use it, and go from there. So there's not a huge financial commitment in terms of how many patients you're planning on seeing, or whether or not you would like the test itself. Basically, Isomeric is designed for beginners and smaller practices. Takes a lot less time, and really anybody can do it. And not for nothing, but it takes up a lot less space. If you're an allergist, you have the space to store all this stuff. That's fine. But in a general practicing office, there's a lot of moving parts. So the fact that this can be stored in a small spot goes a long way. So ultimately, looking at Isomeric in terms of competing with Greer, Isomeric is basically better designed for primary care doctors. Takes a lot less time to learn and to apply, and is not as big a financial commitment up front. Now, looking at some of the services that are out there, one of the drawbacks that people have been, or doctors have been providing, is that they don't want the liability. So when a service comes and does it for them, the liability is on them. Well, the three main things when it comes to service that Isomeric has uh, is saving a lot of space, saving a lot of money, and allowing doctors to do things on their own schedule. In terms of saving space, you're not going to have another person in your office, or using the space that you need throughout the day, whether it be an office or just hanging out. You can kind of utilize the space on your own, make things a lot more efficient. You can save money because every patient that you test with Isomeric, the revenue goes right into your pocket. If you have a service, you obviously have to pay the person to come in and do that. And you can also test on your own schedule, and that goes a long way. If you have a patient that walks in and want to get allergy tested, you can do it right then and there. In 15 minutes, they're out. They know exactly which allergies they have. But when you have a service, you have to wait for them to come. You might have to schedule off a day. You might not work around everyone's schedule. Ultimately, it's just more efficient with Isomeric. And in terms of liability, going back to that point, well, Isomeric, our testing doesn't even break the skin, so there's really not a whole lot of risk of anaphylactic shock or anything. In fact, there haven't really been any cases to date of such a situation. Also, for a peace of mind, consent forms are provided to the patients that they all have to sign before they do the test. So again, liability is taken out of the doctor's hands. And then, epidural pens are provided for peace of mind if they really feel necessary, but they haven't been used yet. So hopefully we won't run into that problem as well. There have been no instances with any such liability problems with Isomeric, and ultimately it's been a great product.